Good morning and welcome to the March Joint Board of Health and Hospitals meeting for the city. Let's get started here. My name is Tim McBride and I'm the interim chair for a few more minutes. So the first item of business is the approval of the Zoom video from the minutes. The notes say January, but it should say February. So do I have a motion to approve those minutes?
Move approval.
Is there a second?
Second.
So everybody who's board member, could you raise your hand or say aye? Or
Aye.
Aye.
anybody opposed? Okay, those the video in lieu of minutes is approved. Before we get started, I'd like to take a moment, if I could, acknowledge the passing of a friend to public health in a region, a friend to many and a tireless advocate for social and racial justice, Cora Faith Walker, who passed away last week. She was a fierce advocate for the poor and the underserved and the uninsured, public health. She brought her considerable intellect and talent to these causes and forged compromises across the aisle. Cora was a distinguished and exceptional student at Washington University, where I served as her advisor in the inaugural class of the MPH program, and at St. Louis University, where she got a law degree. We honored her for the Distinguished Alumni Award in 2018. She was a commencement speaker in 2019, showing her advocacy for causes. She moved to Ferguson and was elected to the legislature in 2016, and then moved on to serve as the chief policy director in the county executive's office. She never forgot where she came from and served as a mentor for students, for pretty much everybody in the region. So she's survived by a loving family, her husband and her parents, who I've gotten to know. So there's been a huge outpouring of love and support for Cora, and there's a memorial tomorrow. So I'd welcome any other comments if there are any, or we can just have a moment of silence. Thank you very much. Okay. Moving on to our next agenda item. Thank you for that. I'm going to turn the agenda over to Linda Racklin, who's our chair of the Governance and Nominating Committee.
Thank you very much. I am very pleased today, first to start by thanking Dr. Tim McBride for assuming the role of chair of this board after the recent departure of Dr. Rhonda Ballou, who had to move on to another professional position. So, Tim, we're so grateful that you stepped up and have been fulfilling these duties and leading the charge here for these last few months. So we're all grateful to you for your service. As our December minutes reflect, when Dr. Ballou notified us that she needed to vacate or resign from the office of the chair of this board, she appointed Dr. Tim McBride to serve in the interim as our board chair. At that time, we commenced nominations period for the chair position of the Board of Health. The nomination, one nomination was put forward for Serena Mohammed. To our committee's knowledge, that is the only candidate nomination we have received. Thankfully, Serena Mohammed has agreed to serve as our board chair beginning in April. So today I want to bring forward a motion to approve, ask for you to bring forward a motion and vote to approve Serena And we'd also like to ask for a motion for you to approve Dr. McBride to continue serving in his capacity as vice chair until Sareen Mohammed has the opportunity to transition into her role and perhaps think about who she would like to have serve as her vice chair in ongoing capacity. Are there any questions or discussion before we continue to a vote?
I enthusiastically move to have Sareen Mohammed elected as board chair and Tim McBride continue as vice chair pending Sareen Mohammed's official occupancy of the chair.
A second.
Second or third.
We have a first, a second, and a third.
Thrilled to have those motions. All in favor, please signify by saying aye or raising your hand.
Aye.
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 Any opposed? Any abstentions? So the motion carries to nominate Sareen Mohammed to elect Sareen Mohammed as our new board chair and for Tim to continue in his role as vice chair beginning in the month of April. So thank you so much, Serena. I just want to say on behalf of our committee, we're so thrilled and delighted to welcome you on into this leadership role. Our committee is happy to help with anything regarding the charter or bylaws or anything else from an organizational or compliance capacity. With that, Tim, I'm happy to turn the agenda back over to you.
Thank you. Thank you, Linda, and thank you for leading that nominating process and your skilled leadership of the governance committee. As always, you've navigated us to a nearly full board, and if we'll turn back to you later to see where we're at on that. And thank you, Serena, for agreeing to serve. You're going to be fantastic in the role. Your unanimous support says a lot. So look forward to working with you. Dr. Maddie, I think you're next on the agenda for your COVID-19 update and other. I think that's our main first agenda.
Thank you so much. I'll just take a moment to share screen. Can everyone see the slides?
Yes, we can. Thank you.
Okay, so we will start with so today's slides may appear a little bit different than what you're used to. We're going to be talking a little bit about the same metrics, but also transitioning you to become familiar with the CDC metrics that have now that we are now also representing based on their most recent updates. So here we have the St. Louis City COVID-19 epidemic curve. The 7-day case count average continues to drop, which is very reassuring, and has fallen to just 11 cases per day on average. This is the lowest daily average that we've seen since June 22nd of 2021, which is roughly 9 months ago. When we look at the COVID-19 testing volume and results on your screen, the number of tests being performed each day peaked at nearly 4,000 combined PCR and antigen tests. But since then, the number of daily tests has dropped to roughly 700 per day. This estimate, though, needs to, we need to consider that this could be impacted by the widespread availability of at-home antigen tests, for which we do not have a reporting system, as you know. And so we are confident that we're going unreported to local public health departments. Testing trends are influenced by access and availability, public interest, the level of transmission in the community. So when viral activity is low, testing decreases because there are fewer symptomatic individuals and there's lower perceived risk, which translates to less concern about getting tested. While some of that is valid, you shouldn't get tested unless you meet the criteria. I do have a concern that we may have individuals who are asymptomatic still circulating. And so we'll talk a little bit about how we're approaching that at the Department of Health. So here we're going to look at the COVID-19 percent positivity. And you can see here that the percent positivity declined rapidly from the Omicron surge, which is the largest surge in the history of this pandemic, down from over 35% at its peak to roughly 2.9% currently. This is the lowest it's ever been, and that's something to celebrate. Percent positivity below a target of 5%, as designated by the CDC, by the WHO, meets the criteria for low transmission risk per their new guidelines. So this is a COVID-19 case density map by ward and neighborhood. Transmission has cooled off significantly across the city. As you can see, this is usually a much deeper red consistently across both maps. The southern neighborhoods continue to have the highest generalized activity, with one major bright spot seen in Tower Grove South. So let's talk a little bit about this paradigm shift from eliminating transmission to mitigating severe outcomes. So because SARS-CoV-2, the virus that causes COVID, is too contagious to eliminate entirely, public health strategy has shifted, as you're probably aware, in the last few weeks, to prioritize softening the disease's impact on society and health by preventing medically significant illness and minimizing the burden on the healthcare system, as well as protecting the most vulnerable through vaccines, therapeutics, and COVID-19 prevention. Vaccines are extremely effective at preventing hospitalizations and death. We know this. Breakthrough infections are typically mild or even asymptomatic in vaccinated and boosted individuals. We have new treatments now, something we've never had, such as antivirals, Paxlovid and Remdesivir, and monoclonal antibodies that can help lessen symptom severity in those who can become infected. And given how quickly and widespread Omicron swept through the country, the unvaccinated population is likely to have some degree of natural immunity from being infected. So this is really the background and the impetus behind which the CDC made its recommendations. I do want to draw your attention to a few of my concerns. I was recently on a White House COVID task force phone call that I was invited to attend, where the topic for discussion was, you may have seen that there are concerns that Congress will not approve COVID-19 funding for this next cycle. What we've been made aware, what we've been made plain, what we've been told very clearly by the White House is that this will impact all of the things on this screen that have largely, that have been a big part of the reason why we're making this paradigm shift. So per their report, vaccines, we won't be able to manufacture more vaccines after May, other than to provide boosters for immunocompromised individuals, but certainly not for the general public, and there will not be enough funding for additional boosters if they are needed. Again, past May or June, they do not believe they'll be able to produce more of the antivirals to any sort of significant degree. And so I think that we need to keep that in mind, and there needs to be significant advocacy at the federal level to ensure that this paradigm shift that is occurring right now is appropriate. So here before you, we're going to start looking at the dashboard updates, the CDC community level metrics. So this is representing the change in strategy. CDC has issued new guidance to categorize community level risk. The city of St. Louis has now updated its COVID-19 dashboard. You can see a screenshot in front of you to provide the 3 recommended metrics for the public to follow the city's community level. These are the 7-day case rate, the 7-day hospitalization rate, and the percent of hospital bed occupied by COVID patients. Currently, like I said to you earlier, the city is in the low risk category. So if we look at nationwide hotspots and the BA.2 subvariant, there is a new variant that is a sublineage of Omicron named BA.2. It is spreading in Europe and Asia. and has the potential to cause a new wave in the US this spring or summer. It already represents about a quarter of new cases in those jurisdictions. It'll be worthwhile to keep a close eye on our metrics over the coming weeks. With that said, case counts have been dropping rapidly across the US, and as a result of the greatly improved situation, the CDC has issued the new guidance for jurisdictions that I mentioned in our previous slide, and public health authorities to use for policy decisions, including rescinding the mask mandates like the city did on March 6th. So let's talk about new and current COVID-19 hospitalizations. The number of new and current hospitalized patients in the pandemic task force regional hospitals rose to record levels in January. Fortunately, that number of new hospitalizations has been sharply decreasing and are no longer at critically high levels, as you can see here by the 7-day average depicted. Let's talk about COVID-19 case demographics and ethnicity specifically. So Hispanic and Latinx individuals were disproportionately impacted by COVID-19 early in the pandemic, but over time, this relationship has inverted, with non-Hispanic represented in the demographic being diagnosed at a higher rate. The rate ratio is shown by the dotted black line in the screen in front of you. A rate ratio above 1 means the Latinx community were more likely to be diagnosed, and a rate ratio less than 1 means they were at lower risk compared to non-Hispanic individuals. The Latinx community have a 73% vaccination rate compared to 59% in non-Hispanics, which may help to explain the change in trends when vaccines became available. So, we wanted to be able to show you this data that we haven't given to you in this format before, because I think it's really important and really underscores the importance of culturally sensitive and culturally competent interventions within the pandemic. When we look at race, African Americans have been disproportionately affected throughout this pandemic. This is shown clearly by the rate ratio being well above 1 for the majority of the past 2 years. And that again is depicted by the black dotted line. So far in 2022, though, the risk of diagnosis for African Americans and Caucasians is roughly equal, with a rate ratio of 1.05. DOH efforts, and here in the Department of Health, like providing vaccination clinics in underserved areas and being specifically attentive to zip codes, and working with our federally qualified health center partners has helped this trend move towards equity. When we look at demographics by age, in 2022, the proportion of cases of age greater than 60 has increased. Outbreaks in long-term residential facilities contributed to case counts in the elderly population. Booster doses are critically important to protect our seniors in our community from severe morbidity and mortality. Pfizer and Moderna recently asked the FDA for authorization to give seniors 65 and above a 4th dose to keep their immunity levels sustained. In the interest of time, I'm going to move to this slide here. So let's look at vaccination in the pediatric population. As of March 11th, 48.1% of eligible school-age children have received at least 1 dose, and 40.2% have completed their series. Children living in predominantly African-American zip codes have much lower vaccination rates, and this is the current cause for concern here in the Department of Health. 30.9% received at least 1 dose compared to 70.6% of children in predominantly Caucasian zip codes. Unvaccinated children are more likely to suffer from secondary consequences of COVID exposure and infection, like time lost learning. So this is something that is of great concern to us, and that we've been focusing our zip code level data efforts. And I've been meeting weekly with our school leaders as a result. So when we look at vaccination rates here, the number of 1st, 2nd, and 3rd doses have decreased in recent weeks, unfortunately. St. Louis City is now 61.4% fully vaccinated in the eligible population, and 1 in 4 eligible residents have received a booster dose, and those are aged 12 and above. So we are also focusing our attention on education and in campaigns around boosting individuals, as that is the best tool that we have in our toolbox to protect against the virus. So when we look at neighborhood vaccination clinics, the Department of Health has been holding small neighborhood clinics to bring the vaccine to where people live. The purple pins on the map show DOH-sponsored clinics to date in the month of March. At these clinics, the DOH administered 353 doses. In addition, we have been working with vaccinator partners like our FQHCs and school districts to administer vaccines. A total of 553 vaccines were administered by our partners so far in March, which also underscores the importance of leaning into our trusted messengers. Lastly, I just want to give a report about a most successful visit. We were the first public health department in the nation that the current CDC director, Dr. Rochelle Walensky, visited in a recent trip to give grand rounds at Washington University. She reached out, her team reached out to me directly to request a time to meet. They initially offered 1 hour, but I went back to them and asked if she would be willing to consider spending 6 hours with us, because I thought it was critically important to really utilize that opportunity to do a few things. The first was to allow our staff, who have worked tirelessly during this pandemic, many of those leaders who are with us today on the screen before you, they have spent the last 2 years being the front line for this pandemic and have done extraordinary work. So we took some time to show her examples of both our COVID and non-COVID initiatives. We took her to our Health Stop testing and referral center, where she got to hear more about our STI and HIV testing initiatives. She was incredibly impressed. Her background is in HIV, both clinical and research. And in a moment, I will allow Franda Thomas to talk to you a little bit about not only that, but what's happening in her bureaus. But this was incredibly successful. We also took her to one of our partner COVID-19 testing clinics as well. After that, we had a hour-long meeting where I discussed more in depth what we're doing in St. Louis and proposed potential collaborations between our Department of Health and the CDC. But what I spent the most of my time with was bringing to her attention the critical needs for small health departments such as ours that are also underfunded and requested critical resources. She was incredibly receptive and quite honestly surprised to hear what it's like for health departments of our size that don't have a lot of the resources that the larger health departments like New York or our colleagues on the West Coast do. She followed up on her word to assist with resources. And I have a series of meetings starting next Monday. I'll be meeting with one of the heads of their fellowship and E&I programming to provide some assistance to our health department by way of work capacity, potentially. So those conversations will begin on Monday. I also made an introduction to Dr. Faisal Khan in the county to ensure that the county also had access to the CDC in this way. The last part of her trip, I thought it was important to give our CEOs of our federally qualified health centers an opportunity to meet with her. They, again, have been incredible in providing care to the most vulnerable throughout this discussion. We spent an hour having discussions, really tough discussions, really holding the CDC and her accountable for the difficulty and some of the challenges that we've seen in the way that this pandemic has played out. And she, again, I have to be honest, was very receptive, very transparent and honest. And they had the opportunity to request resources as well and to give feedback. And lastly, we then gave her a tour of CARE STL on MLK Drive. And you could tell that it had a deep impact on her and her staff. We have received a lot of feedback from them. And one of her staff who has done programming for the CDC for over 20 years said that this was within the top 5 visits that she's ever coordinated for the CDC. So I just want to take that opportunity to thank the leadership, my staff that are on this call for how well they represented us. And hopefully we will see the results of how that plays out in the future, in the near future. I will stop now and take any questions.
That's fabulous, Dr. Maddie, and congratulations on that successful visit and suggesting all those extra stops. And seems like there'll be some tangible outcomes from that. So great work. Questions that you might have? Think
Well-
you're mute. Yeah, go ahead.
Okay, so I was, someone in front of me? Sorry.
No, go, please.
So I was going to talk, so Dr. Maddie, in terms of the resources, how do you reconcile this kind of disconnect at the federal level? There's not going to be a significant ongoing support, and yet Dr. Walensky is saying at the CDC, we're going to be out there really behind you. What was her sense of the federal movement to reduce COVID support? Was she optimistic that there could be some interventions?
So the issue around Congress did not come up until after her visit. So during her visit, I was not privy to that information. That came out in the news just within this past week. So when the conversation came about, resource poor settings, and sort of the discrepancy between larger public health departments, she just owned it. She admitted, yes, that's absolutely right. She was shocked to hear. I made sure to give tangible examples. We put together sort of a report of about 15 pages for her with note sections at the back so that she could actually, take notes and really take back a lot of critical information. And she was visibly shocked by certain things. And I'll give you an example. 3 of my non-COVID priorities, right? We've talked about these at these board health meetings: violence prevention, behavioral health, and chronic disease. If you look at the organizational table for the health department, they don't exist. There's not one person that has been hired to do any one of those things as an individual. So we are not, we cannot operate in any meaningful fashion. So when I made that available to her, I had the TO actually blown up on the board in my office. I had the annual report in front of her. She was visibly shocked. That's not something I think they're accustomed to seeing and in these larger cities, right? And a lot of the places that get the press are, for good reason, they do incredible work and are cutting edge health departments. But for me, it was important to say, what about the Midwest? What about people, rural jurisdictions? What does that kind of support look like? I'd done a little bit of our research. We know that some of these programs exist, but prior to me being director, I'd never seen sort of that presence here, and wanted to be clear as to whether it was just our own not knowing and maybe not leaning into resources that are readily available, or if there needs to be an increased level of support. So like I said, she immediately made those, I heard from her chief of staff 2 days after her visit, and they linked me with the folks that we'll be meeting with on Monday. I can only hope that there will be tangible outcomes. And, there's a common saying, you shoot your shot. I shot my shot, and I'll continue to hold them accountable. And one of the examples she immediately gave when I talked to her about the TO not representing any part of our non-COVID priorities was she said she could see a situation where CDC fellows and other CDC staff could be deployed here. She was most excited around behavioral health initiatives, because that was the time when we'd had a great number of deaths around the opioid crisis within the city of St. Louis. And so she saw that as an immediate crisis in need. And that was one of the areas that they're interested in talking to us on Monday. So one of the things I do purposefully is I am transparent. I think transparency helps me to hold myself and other folks accountable. So I will continue to be transparent in that way. I think you can tell that the CDC director is a good person, a person who also, I can relate to this as someone who inherited a difficult situation. I can't imagine what that's like at a national level, but at the same time, there's work that needs to be done. So the issue around Congress is one that I haven't had a chance to speak to her office about. That was only with the White House task force. And my very transparent feedback in the meeting, when I was given an opportunity to speak, is there's a disconnect between the urgency around where we are with the pandemic and funding, right? When the message at a national level is almost like the pandemic is over, we're going towards endemic, lifting of mask mandates, that can maybe give the impression that those funds aren't a priority. And their response to me when I asked that directed question was that it is certainly of urgency to them, that they have been making that clear to Congress that President Biden feels strongly that those funding is needed, especially for the most vulnerable moving forward, and that they were asking for anyone who has that level of advocacy and leadership to contact their local congressmen and jurisdictions around advocacy for those COVID funds. So that's the response I got there.
Well, thank you, Maddie. Dr. Maddie, we know that you're not going to throw away your shot. So we can make a musical about that, but I think it's already been done. So.
Yeah, there we go.
I think it has, Dr. Ross. I think it has. Any
Yeah,
other
so-
comments or
Yeah,
questions?
looks like Colleen's got a question.
Yeah, just a brief question. How are you thinking about, as the CDC has moved to really reducing morbidity and sort of long-term consequences of, as you said, a more endemic approach, how are you balancing that with, as we are seeing, and we should have expected, increasing rises of new variants and things as it relates to mask mandates? And part of me, I will totally be transparent, is interested in sort of how you're thinking about this and messaging it, because as somebody who also needs to decide the mask protocols for my organization, I'm just wondering sort of how you think about, or how we are thinking about managing mitigation strategies in the future if in fact we are faced with another sort of at least temporary crisis in caseload.
That's an excellent question, Colleen. Thanks for asking. So if you notice, the immediate reaction from the health department within less than a week of the new CDC guidelines was we uploaded our own policy. If one of my PIOs is on the call, if you could just drop the link into the chat. But we immediately released our own recommendations moving forward. While we did not feel empowered to continue in mask mandate, both because the data, to be fair, was dropping and had stayed low, but because there was no longer a federal support to do so, and local public healths are only as strong as how empowered we are at the national level. So what we did was produce our own simple one-page document around our recommendations. And within that, we made it very clear that we continue to, and thank you so much, Kim. If you could also put the Board of Aldermen resolution for support in the chat as well, I'll speak to that as well. So what we said within this link that the mask policy update just within a week of that is, number one, we strongly recommend masking indoors to continue for a number of reasons, especially for high-risk individuals. The reason why we continue to strongly recommend it is because we believe that the burden upon the people that are most at risk is still too high. Our seniors, our immunocompromised. The CDC, in the same day that they dropped their new recommendations, gave a list of 24 conditions, 24, for which they recommended speaking to your doctor by way of resolution. As a physician myself, and as a person, at the public health department level, I am the director of health. And if I called my doctor today and said, hey, I need to talk to you about something, I would be weeks away, even with my level of privilege. So we know that most individuals won't have the opportunity, and many of the most vulnerable don't even have a doctor. And we believe that at least 50 to 60% of the total population can be represented by one or more of those 24 conditions. So for that reason, we still highly recommend masking indoors, because we believe community prevention is still critical. So that's the first thing we did. The second thing we did is we still continue to highlight the need for additional mitigation strategies, that these have not gone away. While rescinding a mask mandate may make people overly confident about the state of the pandemic and what they can and cannot do, our messaging has stayed the same. And our PIOs, who I just want to thank publicly right now, Kimberly Vandenberg, Harold Bailey, and Jasmine Frangel, who is new, and I'd like to introduce her. She is a CDC, comes to us from the CDC to assist with our communications efforts and education efforts. They have been intentional about weekly COVID education. I've also, starting this week, have been putting out small videos that we will be sending to schools as well around these mitigation strategies. So it's continuing that consistent education and messaging about the fact that we're not out of the woods, and you cannot draw back by way of mitigation strategies. What this looks like in the future, though, is simple. We at the Department of Health will continue to be data-driven. If variants come that are variants of concern and have an increase transmission according to the metrics provided by us by the CDC, so that we are in a category that requires it, we will reinstate a mask mandate. The difficulty, though, as you all know, and I've said many times on this call, is mandates are only as strong as how they can be enforced across the region. And unfortunately, what's happened within the state of Missouri around, pushing back on mask mandates and disempowering other regions that don't have the legislative support that we have and backing that we do, means that St. Louis City is an island, and it's not impactful if we're the only one that can put in place a mask mandate reliably. Does that answer your question, Colleen? Great. So I'd like to thank the Board of Aldermen who also supported our policy update that is here. They then passed this resolution to also strongly recommend masking indoors. Other questions or comments?
So I hadn't thought of this until I was listening, but one question we might want to consider as board is, and I'm getting this on other boards that I'm on, when do we start meeting in person again? What do we have thoughts about that? And maybe this is for Serena to figure out. I'll punt it to her. But we don't really have to. Go ahead, Serena.
Yeah, I would say I would probably have an opportunity to check in with folks individually about that, not during the meeting, but we just went through that process for my own organization. So I have some ideas about how to start that conversation as a group.
Okay, that sounds great. I might have one other quick question. Dr. Manny, you mentioned these 24 conditions and all that. There's this growing awareness of long COVID and that may not be under the purview of the Board of Health, or Department of Health, or it's more, it may be handled elsewhere, but what's your thought on that?
Long COVID, I think, is another concern. I think when we talk about COVID, we tend to be very short-sighted in our discussion, and we think about the now. And yet we know that long COVID has had and continues to have significant impact on our community for many folks, especially the most compromised. I'll also add to that, not knowing the long-term effects that COVID is going to have on children and their development. And so I do believe that for that reason, it's critically important that we don't pull back on congressional funding. We do not pull back on mitigation strategies, and that we're very thoughtful about how we can, enter into the new normal in a way that we haven't been able to without leaving the most vulnerable behind, right? Just thinking about ourselves as individuals, throwing caution to the wind and not being thoughtful about the impact that it has on that community means that we're willing to essentially sacrifice the most vulnerable. And that's unacceptable. That's not something that I will ever accept as a leader. And where I'm grateful is that we are unified in this region. Dr. Faisal Khan, a great ally with whom I've been meeting weekly with since I started my role, and our respective Board of Health as well together have been doing so. And the Pandemic Task Force continues to meet. So we're continuing to have those conversations. But long COVID is something that you just don't hear enough in the conversation and should be represented, because it means that until we have a good handle with good funding, research, and interventions for it, that we need to continue to be mindful of our mitigation strategies.
Thank you for that answer. Dr. Gaffer, did you want to say something? You revealed your microphone.
Yes, I have a question for Dr. Mari. When you mentioned that there is nobody assigned to behavioral health initiatives in the city, that would the taking care of the opioid epidemic would fall under that non-existent person's responsibility?
Yeah, you're absolutely right. And that's why meeting with you a few weeks ago was critically important to me. The way that we currently operate, as we discussed at that time, Dr. Guerrera, is that we have to subcontract out. We have great partners who do this work, but that's not a sustainable model. Neither is it a healthy model for a public health department. So in an ideal world, I would love to have a capacity that tends to all of our priorities: violence prevention, behavioral health, and chronic disease, as well as all of the excellent work we're doing in other agencies, but it puts an incredible strain on, my staff who are on this call, because they are required to do their traditional roles whilst also fulfilling the roles of those of some of these initiatives, which they just don't have the capacity to do. And again, I've talked at these meetings before about the limitations of subcontracting out everything we do at the health department. It makes oversight, it makes strategic planning, it makes a cohesive approach all very limited, and oversight is challenging too. So yes, this is a critical concern, and one that I think it's important that I start bringing these things to the table, because I think the layperson in the public may not be aware that the current infrastructure of the health department does not support a lot of the critical priorities, and so we're limited in what we can do. I have to thank Serena Mohammed, who has been a longtime partner of the city, and without whom a lot of these initiatives would not exist. Through her work in multiple roles, I don't know how she does it, honestly. I don't think she has the same 24 hours a day that I have. We've been able to carry out a lot of the behavioral health, some of the violence prevention priorities over the years. But again, the goal must be to empower the health department to be able to do this internally and to have the expertise and work capacity to do so.
It's strictly a funding issue at this point.
Oh no, funding is there. So for example, me and you talked about ARPA funding, right? ARPA funding is there, it's limited and it's short term, so I can't prescribe it to long-term initiatives, but it's a staff capacity, and that's limited by a number of things. Number one, salaries in the city of St. Louis continue to be inequitable. The mayor is working tirelessly to resolve that. The second issue is around personnel. The way that personnel is done through the city means that it is sometimes up to a 6-month turnaround between posting a job and getting someone in. Since I have come in, we have hired record number of people. The Department of Personnel has told us that they have seen great improvements in our ability to work with them to turn that around, and our turnaround time has decreased, but it's still a challenge. So when you don't have competitive salaries, and when it takes a while for people to come in, plus you train them, not to mention coming out of a pandemic, there's been incredible turnaround because people are burnt out, tired, overworked, underpaid, and feel somewhat undervalued. That all makes it so that it's a very difficult environment within which to build that work capacity.
Okay, so one follow-up question. So it will be a matter of, there is a job posting for someone who might take over those responsibilities. That's what I meant by funding. There are funds set aside to pay someone, to hire someone to take over those responsibilities.
So I'm the first director that's built in as part of my budget request for the following year, an entire bureau for behavioral health. However, I don't know if the city will have enough funding for an entire new bureau above and beyond all the other things I asked for. They were shocked by my budget. I broke records for what I asked for, but what I asked for is in line with just the basic needs of a health department. And secondly, like I said, while there is technically a salary line item for some of these individuals, these salaries are not competitive. So we are not able to really attract people, the type of people we need for these positions currently. We interview a lot at the health department, Dr. Guerrera. We're constantly interviewing. But as soon as we get to the salary line, it becomes a challenge. So
thank you.
That's an important report. Any other questions from the board? Thank you for that discussion. Okay, hearing none, I think we'll move to the board committee reports. Linda, if you're still around, do you have anything to add on the governance committee?
Yes, absolutely, Tim. So as I think we have reported the last few meetings, we do not have board members terming off in 2022. So we're not in an active recruitment phase as a committee, and we did not meet this past month. Dr. Maddie, I guess one question we have as a committee for you, and I know we've kind of talked about this on and off, but is there anything that our committee can do to address orientation for any of our new board members, or do you feel that that has been covered, or is there any governance piece with which we can assist?
Linda, I will confer with Craig. That's not something that we've talked about for a while, but I think it's a really valid question. Our partnership in regards to orientation and training, I think, has been really great at this level. I think what would be important actually is to get feedback from the board, especially the new members, as to their feedback as to how that was and maybe what we may need moving forward. But thank you for raising that question. I'll take some time to consider it thoughtfully and then report back.
Okay. What would be the best way to get any feedback about that to you, Dr. Mehdi? Would you like me to oversee that feedback and then sort of provide a summary to you?
That would be fantastic. Yes.
Okay. So Tim, I'm just going to let you know that my committee and I will email questions to the board just about about the orientation went and governance in general, and what they found helpful. And then I can also send to the new board members and see what would be useful to them. So, and then we'll summarize and get that information to Dr. Mehdi.
That sounds great. Unless
Okay.
anybody's got any further suggestions, I would say that my memory getting worse all the time, but if people want to remind me if I'm not correct about this, we've had separate sessions that served as orientations. I recall when we had a lot of turnover. That may have been about a year ago or so. Linda, is that right?
Yes, I remember. I think it was last year. If Dr. Eccles, if he's on, could probably remind us. We had those 2 evening or the staff. Could you? Any of the staff or Craig could remind us. We had those 2 evening sessions. They were held at the after work hours around 5 or 5:30. 2 1-hour sessions, I think. Where the various departments provided us an overview of their functions and responsibilities. And then I think we included a short governance piece in that orientation.
That's my memory as well. Craig, you're nodding your head saying yes. That's
yeah, so there was the overall of the department, as I recall, and yes, there was the governance piece that Dr. Ballou helped us put together.
And it looks like Kimberly's reminding us that it was May 2021. So
so the full board has had a pretty recent, within the last year, orientation, but I would like for us to be able to do something for our new board members. That might be nice. So I will take care of sending out something to our board, Dr. Mehdi, and getting back to you. Thank you.
That sounds great. Serena, were you wanting to say something? Or nope, she's okay. Any other questions on that? Okay, sorry.
I think that's it for our committee right now, Tim. Thank you.
Sure, great. Okay, Academic Public Health Committee.
I do not have a report today.
Okay, that's fine. Health Communications Committee, Harold, it looks like you're ready.
Yeah, the committee did not meet since the last meeting, but we did want to show you some of the work that Lisa has helped us with in representing the committee. Colleen asked about how we're moving forward with messaging with the change of the policy. Here's the new social media image that we're using. And we'll probably look at using this on billboards and maybe some transit ads. But it shows our transition from originally the masking was mandated. So now, as Dr. Mehdi said, the language is strongly recommended. So we'll be using this in our social media. The next item is the poster that you've probably seen around the city. And again, it shows that we're transitioning from mandated to strongly recommended. So you'll see this around the city as we move out those old posters. The next item is a short 30-second video that we're using the sound from this on. We'll be using the sound from this on radio, and Dr. Mehdi has is the spokesperson. It relates to one. I don't know if this is the booster message or the vaccine message, but one is for boosters and one is for pediatric vaccines.
It's the booster. And please let me know if the audio doesn't show.
Okay.
We're not hearing the sound, Kim.
Give me one moment. I do apologize for that, Al.
I know this is hard to get done, so thanks, Kim.
Hello, I'm Dr. Mati Davis, Director of Health for the City of St. Louis. COVID-19 vaccines are effective in preventing severe disease, but their effectiveness may decrease over time, especially in people age 65 and older and those with chronic medical conditions. The City of St. Louis Department of Health encourages everyone 12 years and older who are fully vaccinated to roll up their sleeves again to get a booster. For a list of City of St. Louis Department of Health supported COVID-19 vaccine clinics, visit our website.
So it has to be 30 seconds, and you'll be hearing that on the radio, on some of the radio stations.
And Harold, this one is the pediatric vaccine. Yes.
Hello, I'm Dr. Mati Davis, Director of Health for the City of St. Louis. The City of St. Louis Department of Health joins other medical and public health officials in encouraging parents and guardians of children aged 5 to 11 to help get their children to roll up their sleeves for a COVID-19 vaccine. Let's work together for safe and healthy family and social gatherings, in-person learning environments, and the long-term well-being of our children. Be safe and be well, St. Louis.
So we just wanted to give you some visuals on some of the discussion that happened earlier. So that's how we're moving forward. That's all I got, Dr. McBride.
Excellent, Harold and Dr. Mati, you have a future as a TV star, I think.
Nope, never that. never that. We should do a blooper reel of what it's like getting that footage, and you would be saying the opposite. But thank you, my friend. It really is a testament to Harold, Kim, and Jasmine, who have just changed the face of how we do communications. Our engagement, as we've reported earlier, has shot up over 250% across the board, all social media platforms. People really come to us now looking for this information or asking for these videos, and they're tireless. There's so much more they haven't shown you that I hope to share with you, but they have really thought outside of the box and have done a phenomenal work. So kudos to our communications team.
Well, she's forever modest, but okay. Questions for the Communications Committee? Great work, Harold, as usual, and your whole team. Okay, hearing none, I'm going to turn it back to Dr. Mati for departmental updates, if you have any.
I do. I know you're tired of hearing my voice, so my team has done a great job of compiling these, but I'll try to keep them brief. I'm going to see if Tanya Madden is still on the call. She may have had to jump off to do some important work, but I did want to just give her an opportunity to give her report. I'll be doing this for my leadership over the coming weeks, because I think it's important for you guys to see the true faces who do the work. A lot of times it's the directors and the commissioners who get all the shine, but really it's the folks across the screen who are doing this. Tanya has been a part of some really important initiatives lately, and I wanted to give her the opportunity to give her report. Thank you, Tanya.
Dr. Mati, and good morning, board. One of the reports that I just wanted to share for grants administration is that we weathered a HRSA site visit last week. Although it was very strenuous on myself and the team, I just want to say that we didn't come out with flying colors. We had a few findings, but HRSA is very good feedback, and it showed promise that they will work with us and that we will be able to work with them and get some TA to rectify all the findings. But they also gave a lot of kudos for the team from our last finding, which was, I think it was in 2017, that it was like 20 something findings last time, and now we only got about 8 or 9 this time. So that shows a great improvement. And also I did get a personal call from our program officer on Tuesday, and he was just really going on and just ecstatic about the work that we've done so far. And he's so happy about working with us. And I just want to say thank you, Dr. Mati, for being present. She was there and just gave great praise for the work that we're doing. And they really enjoyed working you, Dr. Marty, and gave kudos to the rest of the team. And I'm just happy and ecstatic that we will continue with HRSA funding, and we're going to be doing great works in the future.
Thank you, Tanya. And she's more modest. So let me just give you some highlights. The HRSA team said they don't think they've ever seen as drastic of an improvement as they've seen over the last 4 years at a site visit as they have done with St. Louis. Tanya is a perfectionist. A lot of my leaders are, so she takes it to heart, even if there's one finding. So it was really difficult on them, especially to have to prepare for a HRSA site visit at the tail end of a over 2-year pandemic. So there were findings, there's corrective action we'll be working on, but by far for me, the headline for that HRSA site visit was an incredible amount of work to improve what had been a really difficult situation 4 years ago. Consistently throughout the week, naming Tanya and other members of her team for being incredible in representing us and the team. And so one of the things that Tanya and I are looking forward to now is to working closely with the Planning Council to have a more cohesive, aligned, and collaborative relationship moving forward, because at the end of the day, our goal is on the public. So I want to thank you, Tanya. I want to thank you, your team. I was beyond impressed by by not only what you gave, but how you represented the city of St. Louis. So thank you, Tanya. Other departmental reports from an environmental health issue. We still have critically low staffing levels for animal care and control. This continues to be an area that I'm trying to work with the Department of Personnel on. We're seeing seasonal shifts taking place for vector control for larvicide operations and community sanitation for recreational water inspections. Upgrades are taking place across all EHS sections to replace old, outdated phones and technology to help serve the field staff better. And our vaccination efforts continue with emphasis on shelter populations and the most vulnerable. DOH continues to offer the vaccination incentive program, which has been very successful and provides Visa gift cards to city residents when they receive a vaccination. So we expanded that from only giving it from the first dose to now all doses, first dose, second dose, and booster. From a fiscal perspective, the FY23 budget for the Department of Health was completed and submitted on Friday, the 11th. I want to thank Emmanuel for his tireless work. He's been working with an almost decimated fiscal department to get this in. The new Oracle cloud accounting system for the city also went live as planned on March 1st. The migration of data from the old system to the new had to happen for all the grants that are still going. And so again, I want you to understand how much work Emmanuel and this team have had to weather, because they've been doing the annual budget, the migrating the Oracle system, preparing for 2 separate audits, including the HRSA site visit. And then we're currently filling 2 vacancies in the fiscal department, and we have been interviewing folks there. We're hoping to fill those positions soon. And again, the HRSA site visit was one of the main areas that Emmanuel was working. So thank you again for your tireless work and all of the sacrifices you've made within a very difficult situation with so many vacancies within your bureau. From a grants administration, we heard from Tanya. From our government services analyst, Craig, do you want to maybe shout out some highlights from your report?
Well, thank you. So Dr. Ross is aware of this, and so Serena, and there may be others as well. Obviously, we are working on the community health assessment as a region. A lot of great people, both in St. Louis County, St. Louis City, as well as all of our partners. That seems to be, and I do this at the risk of people who've been there saying that that isn't the case, but I think it is the case that there is some awesome work in terms of getting input from the community, and that is going to be a continuing effort with KSA, St. Louis County, and the city of St. Louis. So thank you, Dr. Marty.
Thank you, Craig. And we heard from our communication, so thank you to Harold, Kim, and Jasmine. Last but not least, we'll CD, the communicable disease. So we'll start with the Fast Track Cities dashboard, which is a collective effort continuing to gain support from Missouri Department of Health and Senior Services, and has been used as a model for UNC Charlotte's own setup, is being updated currently by our epidemiology department. Our work group, the Epi work group now has a monitoring and evaluation work group, which has also begun to meet and discuss hospital-based data. So this is all towards ending the HIV epidemic. And we also have a prevention and care committee examining intake and the gap between testing and receipt of care services. Our women, children, adolescent health department, so the men's health team will participate in the initiative Working Together Works, which is a collaborative effort to offer men transitioning from prison back to society. Very excited by this. We are also working with the Homegrown St. Louis to discuss an MOU to include potential funding to expand the work done by both entities focusing on Black men. We are resuming lead and asthma education outreach in the community, as well as CPR classes. I hope some of you saw, I started doing spotlights because I think it's so important to show value and highlight some of the great work our health department is doing. We got a really moving letter from a member of the community who said, because of our CPR classes that we offer, they were able to save the life of a family member within the home, and sent a very long and emotional letter to that extent. So these classes are really important, and the work that staff are doing continues to reverberate throughout our community. We have, from a disease investigation, COVID cases are down to less than 18 per day, as you heard, but we are seeing a small increase in flu cases, including some flu B. From an HIV prevention, the Health Stop will continue operating from 8:30 to 1 p.m. Mondays to Thursdays. We have several events for Women and Girls HIV/AIDS Awareness Day. So there's a March 1st town hall in partnership with the National Coalition of 100 Black Women Metropolitan St. Louis chapter. I will be speaking. On March 10th, we're doing a Women and Girls campaign on social media and outreach testing at Legacy Plaza on March 10th, with a Facebook Live or Zoom regarding the effects of HIV among Black women and their partners. And then from March 21 to 25th, we'll be doing LGBTQ Health Week with social media campaigns and a condom bar hosted by Vivint Health. Also, our prevention is going digital. So we're doing a digitalized program to documenting on shared drives. You'll also see our new Facebook page coming shortly. And then on March 15th, we have a rapid HIV testing update. March 23rd, we have STD testing program updates and training. We'll also have some PrEP training at the end of March. So a lot of great things going on in the health department right now. So I will stop there and take any questions or comments.
Great report. Are there questions?
Oh, so sorry. I do want to
please.
start doing this as well. I see Suzanne on the call. I see Valerie on the call and a few others of my leaders. Does anyone have anything to add to what I said? And Emmanuel also on the call as well. Does anyone have anything they'd like to add at this time? No, I see head shaking, head shaking. Okay, thanks guys. Back to you, Dr. McBride.
Great. And Natalie, you revealed your camera. You don't have anything to add either, right? She's smiling at least. Okay, that's great. Questions from the board? That's quite a long list of things that you're dealing with. And just a comment that I would make on almost every meeting I'm in now, and committee and boards meetings, recruiting and HR is a really big concern across the board. And I'm not trying to minimize what the city's facing. I'm actually trying to call it out and make it clear. We all have heard, actually I'm an economist and we don't like the term great resignation because, it's more complex than that, because frankly, what it is people moving around to better jobs, and there's excess demand for people in jobs, and there's retirement, there's concerns about going to work and so on. It's complex. But regardless, hiring people, especially in the health area, has been extremely difficult. There are shortage of nurses, and which really worries me a lot around the whole country in terms of long-term care. At this county health department, we hear about it a lot. So this concern that you're raising, I'm just trying to uplift it and put an exclamation point on how hard it is to hire people.
I appreciate that. It's really evident. We were having a similar discussion with the pandemic task force, and the FQHCs, a lot of the healthcare systems are really feeling this, that we're losing we've lost and will continue to lose critical folks within healthcare because of this very issue. And it's making it even harder for us to tend to the most vulnerable. So a lot of work to do here.
One of the points we're making, I serve on the County Justice Services Board. We're pointing out that, you know, and they have a lot of open positions, that could lead to health problems when you have fewer staff. Then, you know, it's penny wise, pound foolish, because you think you're not, you know, if you're not paying enough, you're not getting enough staff, that could lead to more health problems, which could be more expensive in the long run. So I think that's a message that I'd like to just say publicly and just did. So any other comments? Okay, that's it for the departmental updates. Any old business? Any announcements other than that the next meeting is April 21st? Serena, you're taking over.
I know, Tim. Thank you. He's so ready for April.
He's
Yeah.
so ready.
Well, the weather's beautiful outside. That's good for health, and you know, take my son to the zoo. So, yep. So, anything else for the good of the order? We don't have to, you know, stretch this out to 9:30 if we didn't need to. Well, I want to just say kudos to your team, Dr. Mahdi, and you know, the numbers we heard on the pandemic are encouraging. We're not out of it yet, clearly, but and I want to see if we can continue to push on vaccination, especially for children across the whole region.
Agreed.
And, yep.
Dr. Ross and others, is there anything specific you'd like by way of a special report at the next meeting? And Linda, when you're getting feedback, if you could just put something across, if there's things that folks would like to see different. You hear a lot of my voice at these meetings, and I'm very self-conscious about that. So if there's a better way for us to give you reports, things that you'd like presented, if you could give Linda that feedback too. But I know, Dr. Ross, you had certain questions before. I want to make sure that I slate those for April, or anyone else, if you'd like some special reports from us.
Oh, you've been very forthright and very transparent in getting a lot of our thoughts and concerns to the table, Dr. Mahdi. The only thing I would add is that we hear as a board about the remarkable work that's being done with the city and the county regarding shared services.
Yes, okay.
So if you can
That would be a good
update.
one. Thank you so much for that. I think that is important. At the next April meeting, I'll make sure to give a brief but special presentation and see if I can even invite Dr. Faisal Khan around our monthly meetings we've been having, so you can understand the impetus for those, what we've been discussing, the impact it's had, and then, you know, our goals moving forward. Thank you for that, Dr. Ross.
I think that is a good suggestion, and those have been fruitful. The one thing I might add, since you talked about, you know, shortages and particular staff, and your budget just went in, I haven't seen those numbers. Maybe I could find them, but I wouldn't mind a report, just sort of on a status report on your staff. That'd be great.
Absolutely. Thank you.
Other suggestions people have, if you have them right now, offer them, or otherwise send them to Serena or myself or Dr. Mahdi. Okay. Do we have a motion to adjourn? Is that what you're revealing yourself for, Dr. Ross?
Move adjournment.
And do we have a second?
Second.
Okay. Well, I don't think we have to vote on that necessarily. I'm not great on Robert's Rules of Order, but hearing no objection, I think we can say that we're adjourned for March, and you got a few extra minutes to go out and enjoy the weather. So take care. Thanks.
Bye, everybody.